I should have made it a Kahoot, but we did.
This Kahoot's actually really healthy. I love Kahoot.
Alright, so before we move to celiac, remember we're gonna try to abbreviate all these different hepatitis.
Oh.
So, yay, all the fun, and this is still abbreviated from your book. But we're going to keep it simple. So remember, A and E are going to be your contaminated water, so fecal oral route, and this is attached in additional resources at the bottom of the module. So A and E is going to be your fecal oral route, contaminated something. B and C, I want you to think of blood. So this is going to be your drug users, healthcare workers, phlebotomists, all that sorts of people. And then to have hepatitis D, you must have hepatitis B. So notice it only occurs in people infected with Hep B. All right, so which two can you vaccinate against?
A and
A and B. Classically, we get B on the state side. Hep A, you can get if you're military or mission worker. So those have vaccines for. Which ones have treatment?
B, the green.
Cheat, we're gonna go B, C, and D. In the middle, there are antivirals that we can give them. And then there's all these interferons and, anyway, we're gonna keep it simple. Antivirals that you can give for B, C, and D. So you can treat in the middle. So treat the blood, right? That's the only ones we can treat, is treat the blood. Because those are blood-based, blood-caused. Okay? That's keeping that chart as simple as you can.
Okay, I have a,
Question?
so I have a friend of mine that has immune-mediated hepatitis, which is not viral, right?
Correct.
And that is not transmissible to other people.
It's not.
Okay.
Good comment. Only those viral ones, A through E, can.
Okay.
Then, like if it's alcohol related,
Mhm.
obviously that's not transmissible.
Mhm.
It's just for that particular patient. So cessations, rest, less stress, remove the cause, it should fix that. But good question.
Vaccines are only A, B, and
Vaccines for A and B.
A and B on one.
not D.
Treatment are antivirals for B, C, and D, so your blood ones. Because all B, C, and D are transmitted through contaminated blood. Most often, you're gonna get your acute hepatitis is gonna be your Hep B, and your chronic is easy enough, it's type C, or they call that, sometimes it's been nicknamed post-transfusion hepatitis. So patients that get large amounts of blood, specifically those who got blood between, 1965 and 1987 or something like that. I'd have to check the American Red Cross for what their years are, but Hep C is a post-transfusion usually. Then your drug abusers, sharing needles. All right. Then celiac disease we already touched on, so I'm not gonna spend a whole lot of time there. But notice that your villi are missing in your celiac disease, so that leaves also the chance very much, because it's not cobblestone, I'm not gonna use that word, but because of the flattened villi, that they will have malabsorption of nutrients, so they will have weight loss as well. But their hallmark there is going to be abdominal pain and bloating, and then it's usually after meal times, just like with our Crohn's, and with our gallbladder. And that they will have a relapse typically in young adulthood when they start getting in the alcohol world. So gluten-free diet is the number one way. Then we can also give them vitamins and minerals if we need. Support groups dealing with a chronic condition. There's not a whole lot there. Celiac disease, also most common in women, like Crohn's. So sorry ladies, y'all have the fun bowel stuff, Crohn's and celiac. But our nice little card for you to study, gluten-free diet. We would have malabsorption due to those missing villi. Most commonly iron or vitamin D deficiency. But vitamin D, we can put them out in the sunshine, do phototherapy, iron deficiency anemia, give them some ferrous sulfate, will be good. Long-term complications, due to just having chronic disease, puts them at increased risk for osteoporosis, infertility, and usually reproductive cancers, but it says certain cancers, so we'll stick with that. But most of those females experience anyway, but they will likely get them sooner than your average female patient because of having that chronic condition. Autoimmune in nature, so we may give them some of those biologics or immunosuppressors, and we'll diagnose it specifically from a small intestine biopsy. They'll go and they'll do a test, put it with gluten, but it's done from a colonoscopy. And then we can do serology as well, but the biopsy is usually the best. So we're gonna ask you some questions after we do our classic patient. So they're complaining of diarrhea, stomach problems whenever I eat bread or pasta, because they finally figured out it's the carbs causing it, and then we know it's the gluten. Diarrhea, abdominal pain and bloating, the big one, can have some weight loss and fatigue. You can have your serology test there. I will not test you on those specific, but they are looking for autoimmune disorders specific to gluten. And then most often it's that intestinal biopsy, which shows villus atrophy. And then they magically are better after gluten-free diet and can be in remission as long as they don't touch gluten. The one thing I would like you to research on your own, and you can do it right now because we're not gonna wait and save it for you. Look up some places that gluten is that technically would hide from you. Like, I would have never thought that wheat or gluten is in that thing. I'm sorry,
Beer.
Well, we said, but yeah, beer and whiskey, we figured that one out last week when we introduced it. Give me some weird ones it hides.
Soy sauce.
How about that? Y'all messing up my Panda Express now, okay?
Deli meats and sausage.
Like, I wouldn't think, but you remember that wheat can sometimes be used as a binder to help make it into a loaf that they can slice, so. The one I'm gonna throw at you, because it's weird, is all of your condiments, so mayonnaise, ketchup, things like that, look on there, ranch dressing, salad dressing, yeah. Then there's an emulsifier to help give it that creamy texture, it's really just gluten, giving it that creamy texture, when it would just, cause if you ever, has anybody ever homemade their own, like, if you make your own ranch, it's much more liquidy than if you get it from Hidden Valley or whatever. Cause they're using gluten to make it, give it that nice creamy texture that you would want.
You know gluten's
So-
not just in food, don't you?
Huh?
Gluten's not just in food.
Tell me more.
Gluten is in art supplies like paint and clay. It's also in your personal items, lipstick, skin lotion, sunscreen.
Anything that needs a
Household
texturizer to make it,
Yeah, like envelopes too. Like if you live in envelope.
Yeah.
Detergents.
I mean, it's in a lot of crazy places. So, due to the prevalence of celiac disease, we're starting to have a gluten-free section and be mindful of listing it, and, or, they'll have the asterisk on there that made in a, factory that also makes wheat products or gluten products, rye products, they'll say something like that. So, you're gonna have to do a lot of teaching on the language of what they're gonna have to look for on those labels. Cause it's gonna be insanely hard. Gluten, we think of the wheat and now the beer, cause we introduced it last week, beer and whiskey. But, just gluten hides in some crazy places, so you can't just, I like that you said, Amber, that it's not just in food. Yes, it's literally everywhere. So if it's ingested, can upset. So here are you some true and false questions. Let's see how you do. So, in appendicitis, pain typically starts in the right lower quadrant and then migrates to the periumbilical area. True or false? False. So where does it start? And so it goes the opposite direction, periumbilical to the Murphy's point, the right lower quadrant. Or, excuse me, McBurney's point. Ulcerative colitis is a type of inflammatory bowel disease that affects the colon and the rectum. True. But what if we said it affects the mouth to the anus, or something like that, so that would be false, okay. Gallbladder disease, or cholecystitis, is often associated with pain in the left upper quadrant, especially after eating fatty foods. Right upper quadrant, so that Murphy sign. Okay. A key diagnostic finding in pancreatitis is elevated serum amylase and lipase.
True.
Yes. Jaundice, or yellowing of the skin, is common sign of hepatitis.
True.
Celiac disease is an autoimmune reaction to gluten primarily affecting the small intestine. True. Appendicitis is classified as chronic local inflammation.
It can be either or.
No,
Which
it's,
one?
it's acute.
It's acute, so that's what makes it false, that one word makes it false, so appendicitis would be acute local inflammation. And then if it perforates, may turn into systemic inflammation.
Then it's peritonitis.
Hmm?
Then
Then it would be peritonitis, I love it. Crohn's disease is a type of inflammatory bowel disease. It can affect any part of the gastrointestinal tract from the mouth to the anus. True. Murphy sign, a test for gallbladder disease, is positive when pain is elicited on deep inspiration and palpating the left upper quadrant.
false.
It'll be the right upper quadrant. Right upper. Pancreatitis, pain often radiates to the chest,
No.
radiates to the back, to the back. Gallbladder radiates to the shoulder. I heard you say it. There we go. Okay. Hepatitis A is a chronic condition. False. It's an acute one. Let's see. It can become chronic, but it would be a different type. Because remember, all the viral hepatitis will be acute, but it can cause chronic hepatitis if, like that, we can get rid of the virus, but if the liver damage is done, it can be inflamed for a while.
So trick question.
Trick question. But typically, your viral ones are gonna be acute. Small intestinal biopsy is the key diagnostic for celiac disease. Yes. An elevated WBC is common finding in appendicitis.
True.
Inflammatory bowel disease is characterized by both acute and localized inflammation of the GI tract.
Can be acute or chronic.
False. Inflammatory bowel disease is chronic. Patients with cholecystitis typically have a low-grade fever. True, they could. All right. Here's the who's who. See what you do. Patient presents with right lower quadrant pain, rebound tenderness at McBurney's point, and elevated WBC. The nurse suspects.
Appendicitis.
Perfect. Which of the following is characteristic of ulcerative colitis? So before we even look at them, what are you thinking based on ulcerative colitis?
Red.
Lower GI.
Lower GI, red, irritated, ulcers.
True.
Alright, so let's see. It can affect any part of the gastro tract. Wrong. It is characterized by patchy inflammation.
Not.
It's an acute condition.
Nope.
It primarily affects the colon and rectum.
True.
So there's one, primary, alright. Patient reports sharp right upper quadrant pain, especially after eating fatty foods. The nurse anticipates the patient might be diagnosed with, love it, cholecystitis. Alright. Elevated serum amylase and lipase levels are most indicative of,
Pancreatitis.
but could also be indicators of cholecystitis. Love it. Jaundice is the most common sign of.
Hepatitis.
Which disease is an autoimmune reaction to gluten? What type of inflammation is appendicitis? So acute versus or chronic, so it's acute, and then local versus systemic. So acute local,
Unless it ruptures and then.
and then acute systemic. Patient with Crohn's disease may experience inflammation anywhere in the GI tract. The nurse assesses for Murphy sign in a patient suspected with.
Cholestasis.
The patient assesses this, colon sign for patients with.
Pancreatitis.
They assess for Gray Turner sign in patients suspected with. I'm tired of that one, okay. Patient with pancreatitis is most likely to report pain that,
Goes from the.
Sharp, stabbing, and constant.
and could radiate to the back, we got those. So remember in your study, like this slide says, you're going to find the things that make them different and focus on their differences. What is your vitamin class of the day, pretty much? Fat soluble is your biggest one for these because they're all bowel disorders. So the water solubles will still stick, but the fat soluble, worried about those. Talk about your differences. So what hepatitis are you getting from blood?
C, D, and D.
B, C, D. Which one from food and water?
A and E.
Which ones have vaccines?
A, and B.
A and B. And then which ones have no treatment?
A and C, A and D.
A have no treatment. A and E for no treatment. Signs and symptoms of sepsis.
Fever, tachycardia.
So think about your vital signs. So 4 vital signs are affected. Blood pressure, heart rate,
High,
fever.
yes,
So those you're gonna be high. And then respirations,
high.
high. And then that one blood work.
White blood cell count.
Nope.
Nope.
You could, but the most common ones, the one they love to throw in ice. Lactic acid or lactate, yep. So which one of those disorders came with all of the blood clotty stuff?
Hepatitis.
Pancreatitis. But you could, with hepatitis, have some clotty stuff if it turns into cirrhosis. So if you have late stage hepatitis that now has turned into cirrhosis, try to recall the things that happen with, so portal vein hypertension, esophageal varices, GI bleed, that sort of thing, if we wind up cirrhosis, buildup of toxins. There's a list of drugs up here on A, B, C, D, E, F, G. Which ones are you gonna pick for treatment of hepatitis? Beers, anything in beer. Please not spend your time trying to learn beers, just pick the ones that are beers. Hydromorphone, what we treating with that?
Pancreatitis.
Yeah, what about sulfasalazine? You can just put any of those IBDs, any of those IBDs. What about prednisone?
Any of them.
IBDs, I like those, IBDs. Methotrexate, IBD, even though that's technically a chemo, but we would treat that with that. What about infliximab?
That's
Mab.
That's a virus.
So that could be any of our autoimmune, so it could be Crohn's,
Celiac.
celiac, anything that has autoimmune related to it, you could use those MABs. Loperamide is stop your stool pretty much from running, right? So loperamide, who would have the diarrhea? Your IBDs, but specific, or more often than which one?
Crohn's disease.
Ulcerative colitis.
Ulcerative colitis is gonna have the bloody mucousy stool, but both of them could, but if I had to pick, I would lean UC for diarrhea. Promethazine, Phenergan,
That's, Crohn's disease.
Anything that's vomiting.
nausea vomiting. I'm trying to give you another, because we've already done Zofran or ondansetron, so there's you another antibiotic to add to your library. What about tenofovir?
Hepatitis.
Pancreolipase.
Pancreatitis.
Pancreatitis, that's your enzyme that you may give them. Most often we give the enzymes with what type of pancreatitis?
Chronic.
chronic pancreatitis. I think we're really gonna ask questions, we wanna make sure y'all are covered. 5 signs of inflammation.
Redness.
So remember Prish, so start there, P,
Pain,
R,
redness,
redness, I,
immobility,
immobility, so don't fall for the inflammation, we already know inflammation, so immobility. All right, then S,
swelling,
swelling, H, heat or hot. There you go, you got it. If I gave you a scenario of the patient suffering from this type of illness, would it be acute versus chronic inflammation? So obviously, if it was a short window of time, healed quickly, versus chronic, that it would be long-lasting, but with periods of remission. Local versus systemic, so if you have local inflammation, one spot, 5 signs, maybe some exudate if we cut open the place that's inflamed. Systemic, that's where we get the what? Sepsis stuff, so fever, white count, those sepsis like stuff, love that. Indicators that your inflammation, so like marking the border, so if it goes outside the border, their fever worsens, anything that would indicate that the infection / inflammation is worsening. What were your 2 inflammation specific labs? 2 schools of thought, but you may see either one. You can give me the 3 letters for each one. So the 2 inflammatory, CRP or ESR, erythrocyte sedimentation rate, or C-reactive protein.
I had
Most common group for appendicitis.
adolescents.
Most common group to figure out when are they gonna have the IBDs, usually diagnosed
15 to 30.
15, 30, so early, young adult there too. Strong genetic link. Remember I gave you the study technique of those little HESI hint cards. If you wanna make that your flashcard and you read it to somebody, like, that can literally be your diagnosis, already done for you. Cause y'all have surely seen the little note pages. Y'all can cut them that way as travel size instead of carrying on a paper or a review sheet. What was an intervention for cholecystitis that if it's based on the biliary buildup or biliary stasis, we can use this to drain off the
T-tube.
the T-tube. Try that first.
Get you some, what is it, golden?
Yeah, I got a pregnant mama. She's wanting a golden seal for that cholecystitis. Better tell her no. But does it really science, that's one of the I will actually agree, as much as I love alternative medicine, does golden seal have really a true efficacy based on science and research? Patients, varying patients will say it helps, but there's not enough evidence to, it's a good one. Like, I promise you, you can take valerian root and, lavender and chamomile, those will actually have a sedative-like effect to you, help you with sleep. There's science that says that, but golden seal doesn't have the same backing yet. Talk about all of our signs, you can draw your little picture. That's y'all got, that's kinda it, but if I have clinical with you Thursday, if you will hold tight for like 30 seconds down front, and, no, actually, the thing